It's all in your head. Only women get depressed. If you have depression, you're stuck with it for life. Do any of these statements sound familiar? It seems that there's a myth about depression for every single fact about depression, and this makes it difficult to get a real sense of the illness and its capacity to be treated. Hi, I'm Deborah Gray, creator of Wing Madness Depression Guide. Here are the depression myths that I've heard the most and the truth behind these misconceptions. 1. Depression is not a real medical illness. Clinical depression is a serious medical condition that affects not only someone's mood and thoughts, but also their body. Research has shown that depression has genetic and biological causes. Individuals coping with depression have a higher level of stress hormones present in their bodies, and the brain scans of depression patients show decreased activity in some areas of the brain. This is a real medical illness. 2. Even if depression is a medical illness, there's nothing that can be done about it. Depression is treatable, and more than 80% of people with depressive disorders improve with treatment. As new medications and treatments are discovered, the number should continue to rise. The first step to finding effective treatment is to get a physical examination by a doctor to rule out other causes for your symptoms, such as thyroid problems, for instance. Once you've been diagnosed with depression, you and your doctor will decide on a course of treatment which will include medication, therapy, or a combination of both. 3. Depression is no different from getting the blues, and this is just a normal part of life. Equating depression with the blues is like saying that a common cold is the same as pneumonia. Everyone gets the blues or blahs from time to time, usually in reaction to disappointment or an upsetting event or sometimes in reaction to something as simple as a rainy day. But the blues only last a day or two. Depression, on the other hand, can last a lifetime, and the illness is much more pervasive and disabling. No one commits suicide because they have the blues. 4 is people who think they have depression are just feeling sorry for themselves. Depression affects about 19 million people annually in the U.S. alone. And some of the most prominent and well-known individuals who have suffered from a depressive disorder include Alexander the Great, Napoleon Bonaparte, Abraham Lincoln, Theodore Roosevelt, George Patton, abolitionist John Brown, Robert E. Lee, Florence Nightingale, Sir Isaac Newton, Stephen Hawking, Charles Darwin, J.P. Morgan, Barbara Bush, Ludwig van Beethoven, and Michelangelo. Not exactly people who just sit around feeling sorry for themselves. 5. You can will depression away. If you can't, then you're weak. Depression cannot be willed away any more than heart disease or diabetes can. Among other things, it can be caused by biological or chemical changes in the brain, which cannot be overcome simply by positive thinking and grim determination. Given how much stigma is still attached to mental illness, seeking help for depression is an act of courage and strength, not weakness on your part. 6. Depression will go away by itself. For some people, depression may go away by itself, but for the rest of us, depression can hang on for months, years, or indefinitely. Also, depression can go away on its own, only to return in the future. Once an individual has one episode of depression, they are predisposed to have more. Clinical depression is a potentially fatal disease, and suicide could be the end result of waiting for it to go away without any help. 7. Depression is a normal part of getting older. Depression is not a normal part of aging, but seniors do generally experience more of the events that can trigger depression: loss of family and friends, ill health, isolation, and financial worries. Furthermore, people over the age of 60 grew up in an era in which mental illness was not discussed, and they may feel more shame about asking for help than someone from a subsequent generation. The highest rate of suicide of any age group occurs in that of people 65 and older, with men being more vulnerable than women. It's imperative that seniors with depression seek help. 8. Depression only affects women. Although women report being affected by depression twice as much as men, depression certainly affects men as well. Often, clinical depression is underreported in men, particularly in cultures that discourage them from asking for help or showing any weakness. Furthermore, men have a higher rate of successful suicide attempts than women, so it is crucial that men seek help for their symptoms. 9. Depression does not affect children or teenagers. Their problems are just a part of growing up. We'd like to believe that all children experience a happy, carefree childhood, but that's simply not the case. According to the National Institute of Mental Health, studies show that 1 in 33 children and 1 in 8 adolescents are depressed in any given year. And children can't articulate their feelings as well as adults can, so adults must take the initiative to talk to a child who might be depressed. And 10, if someone in your family suffers from depression, you will inherit it. In the same way that you can be genetically predisposed to high blood pressure or diabetes, you can be genetically predisposed to depression. This does not mean, however, that if a family member has a history of depression, you are fated to suffer from it as well. Just be aware that your chances of having depression are higher than if you had no family history of the illness, and seek treatment if you start to develop symptoms. If this video has been helpful, please consider giving it a like. And if you are interested in seeing more videos about depression, please subscribe. Also, please comment and maybe let me know if there are any myths that you've heard about depression that you find annoying or frustrating or extremely unhelpful. Thanks for watching.